In Kenya, at least 1 in every 4 people that are presented at an healthcare facility does so for the treatment of mental health cases and related issues. This adds up to 40% of the patients admitted.
For the longest time, people have had different perceptions and misconceptions about mental illness. And today we are in the streets of Nairobi to understand if really Kenyans understand what mental illness is and what brings about mental illness. Because people have been thinking that mental illness is something that is spiritual and not a mental disorder. Hi, how are you?
Hi, I'm fine.
Do you understand what mental illness is?
Yeah, I think it's a mental disorder, as in like a condition that causes, it is a condition that causes vitu zingine ziache kufunction vizuri kama brain, and it can be caused by illness, and also it can be genetically passed. Yeah.
Mental illness ni ugonjwa ambao unaweza zaliwa nao na ukufanye ulemavu kwa psychological ama yenye unaweza kumbana na shida fulani ikufanye ukuwe na ugonjwa kama huo.
According to the World Health Organization, Kenya's mental disorder cases account to 5.9% of the total global burden. Dr. Ngugi Gatere is a professional psychiatrist who works with the Ministry of Health and also does private practice. He speaks to us about the state of mental illness in Kenya.
Mental illness are health disorders which affect the mood, the way we think, and the behavior. Yeah. So people with these disorders, you find that they might be having some mood disorders, like feeling low, feeling depressed, or feeling too much happy, or their thinking is disordered, in which they might be having some abnormal thoughts, like believing that there are some people who want to harm them or the people who want to kill them. And of course the behaviors, whereby sometimes some people with mental disorders, they have abnormal behavior, they could be aggressive, or they are quiet and they are withdrawn. So basically mental illness affects 3 main areas, that is the mood, the thinking, and the behavior. The causes of mental illnesses are not known, but we think mental illnesses are caused by an interplay of several factors. We have got 3 major factors which come into play, and when we try to explain mental illnesses, we bring what we usually use what we call as a biopsychosocial model. Biopsychosocial model. Bio means that some mental disorders could be caused. What that means is that it is an interaction between biological factors such as genetics, psychological factors such as stress, and the environment in which you are. But we cannot pinpoint a particular issue and say this is the cause of mental disorders. And furthermore, mental disorders are too many. They are very diverse. In psychiatry, we treat more than 200 mental disorders. So we cannot say that these disorders are caused by a specific issue, a particular issue. Yes. So it depends, number 1, on the disorder, and number 2, an interplay between the 3 factors: biological factors, psychological factors, and social factors.
Prevalence of mental illness in Kenya is attributed to poverty, drug and alcohol abuse, stress, and other environmental factors. For the longest time, people have had wrong assumptions and misconceptions about mental illness. Mentally challenged people have always been seen as a curse and have been stigmatized and neglected.
What are some of the forms of mental illness do you understand?
Epilepsy, madness, somebody becomes unable to coordinate his mind or her mind well, and such natures. Yeah.
Forms of mental illness, that this when you're disillusioned because of drugs that you use. There is scientific terms that I'm trying to picture, but mainly the main form that I know is when you consume drugs and then it alters your thinking, and then
mental illnesses affect a full spectrum, from very mild to very severe, and they affect all ages. If we start with age, for example, a child could be born with mental retardation. Yeah, that is a disorder. That's a mental disorder. As they grow up, they might be affected by other disorders. For example, they could have mental disorders like autism, attention deficit. As they grow and they enter into adolescence, they could have substance abuse disorders, schizophrenia, bipolar, and mood disorders. So we have a whole spectrum affecting different ages. And they range from very mild, the mild stress people call stress, and maybe it could be some mild depression, to very severe mental illnesses like schizophrenia, the one you're talking about, people walking naked and becoming aggressive. So they have a full spectrum of symptoms, from very mild to very severe symptoms. And it depends on the individual mental disorder. Yeah.
And can you say like depression or stress are also other forms of mental disorder?
All of us, we have stress. We have what we call as normal stress, and we have abnormal stress. Normal stress is good and beneficial to you. Like when you are given an assignment by your teachers, and you must finish, and you must pass the exams, that's a form of stress. And because of that stress, you're going to work harder to pass your exams. That is normal stress, and that is beneficial stress. But when it becomes so excessive, and you're not able to control, and you are always thinking about a topic, or there's some issues which affected you, you're not able to sleep, you're feeling depressed, that is what we call as abnormal stress, and that one becomes now a mental illness. Yeah.
Mental health care in Kenya is predominantly government funded, but remains extremely limited in terms of infrastructure, manpower, and finance. Mental health care specialist care is largely delivered at district level by psychiatric nurses, running inpatient units and outpatient clinics.
On top of that, other mental health workers like psychiatric nurses are also less. Maybe that is what you meant. Yeah, nurses, they are few. They are less than 1,000 in Kenya. And these are usually the people who run the district facilities, the public facilities. So that figure is still less. Counselors who also come hardy are not very many. But the good thing is that the universities nowadays are teaching. They have taken counseling courses in psychology, and therefore we have got more counselors. But psychiatrists are few. And the other issue is that there's a lot of stigma. Yeah, there's a lot of stigmatization. Not many people will be proud to say that I've gone to see my psychiatrist, as opposed to when they say they have gone to see their gynecologist or they are going to see their physicians. So you find that even somebody who has got a mental illness, because of the issue of stigma attached to it, will hide or will be reluctant to seek psychiatric help even when there is indication for it. My advice is that mental illnesses are treatable, and if you suspect that you have a mental illness or your loved one has a mental illness, seek support early, seek treatment early, because some of these conditions, when they are treated early, they recover fully.
This clearly shows that there is need to understand mental illness so as to have enough manpower, infrastructure, and adequate capital.
From Nairobi County, my name is Ismail Kevin.